Hi everyone, Nurse Nettie here and welcome back to my channel. Let's talk drug errors and how to deal with them. I've made 2 drug errors in my nursing career. Number 1, 10 months NQN, I'd administered oral phenytoin 4 hours early. I didn't mean to make that drug error, nobody ever does. I'd been looking after this patient on many shifts over the last few months. I knew the drug chart like the back of my hand. I'd gone onto autopilot. Unbeknown to me, the drug chart had been changed the previous evening. That wasn't handed over to me, but that was my error and I had to own it. I immediately apologised to the parent, explained what had happened, and then went to inform the doctor and the nurse in charge. Fortunately, there was no harm that came to that patient. How was this dealt with? Clearly, I was devastated by this error, but I felt really supported by my manager. We talked through the incident. I was asked to write a reflection. We read through it and identified any learning points for me. I was sorry that I'd made the drug error. I was then nervous to go on and carry on administering drugs. It took me a while, but I knew I had to get on with it as it was part of my job. I had to just move forward and put it to the back of my mind. So, how should we deal with drug errors? Number 1, if you're the nurse making a drug error, do not panic. Stay with your patient, make sure they are safe. Whether you need to do observations, give oxygen, whatever your patient needs, make sure you act promptly. Don't forget you will need to let the family know and go and speak to the doctor and nurse in charge. Follow their advice and then return to the patient. Repeat any observations or any procedures that you've been asked to do. Once your patient is safe, it is important that you then go on to document what has happened. Give as much detail as possible so that the next shift can see the history. Then you'll need to complete a DATEX or similar incident reporting form so that learning can be taken for the rest of the team. For yourself, make sure you write a reflection, discuss it with your manager, discuss it with your senior colleagues, identify any learning, and most importantly, learn and move on. Put it behind you. It's happened, there's nothing you can do but move on. My second error was when I was a fairly senior nurse. I was second checker for IV tobramycin. We'd given an extra dose of the drug. We'd given it TDS instead of BD. While we were prepping the drug, we were interrupted, but that is no excuse and we were accountable for our actions. So, how was this handled by my manager? I received a phone call the day after the error. I was on a day off. A manager called me, informed me of the error, and they practically shouted at me. I felt berated, totally unsupported. There was a threat that I might have to redo my IV certificate. I did not find this helpful at all. I was really upset and I did not want a patient to come to harm for something that I'd done. On my next day working, I spoke to the doctor immediately. I was told that yes, it is a toxic drug and it could have been serious, but actually on this occasion, the patient had come to no harm. I spoke to the patient's family. I apologised. Of course, I didn't mean to cause any harm, and I was taking serious learning from this incident. How do you deal with a drug error as the manager? Number 1, support the nurse. They need support. I keep saying it. No nurse wants to make a drug error. Ask them what happened. Were there any contributory factors? The nurse might be distracted. There might be something going on in their life. You must get this information in order to understand and support that nurse. Get them to write a reflection, review it together, and highlight any key learning points that can be taken. Share this learning with the rest of the team. Have regular catch up with the nurse involved, because it might take her a while to get her confidence back to be able to move on from this drug error. As a manager, I've got many years' experience of dealing with nurses who have made drug errors. I'm going to share one example. The nurse in question was a fairly senior nurse. She had made a couple of drug errors and then gone on to make a third one in a very short period of time. My first job with that nurse was stop her giving any medication. This was 1, to protect her, and 2, to protect the patient. I met with her. My first question, are you okay? This was not like this nurse. It turned out after her first drug error, she'd lost her confidence. We drew up an action plan. It was for a 6-week period. She was acting as second checker. She worked closely with the practice educator and closely with the senior staff nurses. I met with the nurse weekly and we went through her reflections she'd written. We highlighted all her learning outcomes, and I'm pleased to say that she was signed off as competent to give drugs again. I reflected a lot on these incidents, and I then became very passionate about improving patient safety and safe medication on the ward. So how did I do this? First of all, drug errors can sometimes start at the prescription. Doctors get interrupted when they're trying to write up prescriptions. So on the ward, we had a desk in the corner of the nurses' station with a sign, "Doctor's prescribing area, do not disturb." Step 2, we moved all the drugs from the nurses' station into the treatment room, which would automatically mean there would be less distractions. We put a sign on the door so that nobody would interrupt if they came in. Nurses were to wear a red apron. I know some areas have the red tabards. If someone did come in while you were drawing up medications, I encouraged nurses to put their hand up and look away and not acknowledge the nurse. That felt very uncomfortable to begin with, but it was another area where we were improving and eliminating risks to potential errors. Also, please don't forget the 6 R's of safe medication. So, do you have the right patient? Is it the right medication? Is it the right dose? Is it the right route? Is it the right time? And have you documented the right information? All this will help you in delivering safe patient care whilst giving patient medication. I hope you found this information useful, and my final message to you is no nurse wants to make a drug error, and if they do, remember it is not intentional. I hope you've enjoyed my video. Don't forget to like and subscribe, and I'll see you next time.